Hello and welcome to JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Caitlin Finn and Dr. Rachel Kelz about simulated comparison of outcomes following colorectal cancer surgery at the best local hospital versus chosen hospital. Welcome to the both of you.
Thanks so much.
Just to start, can I ask you to please introduce yourself?
So my name is Caitlin Finn. I'm a general surgery resident at Weill Cornell, but currently doing a research fellowship in surgical oncology at the Center for Surgery and Health Economics at the University of Pennsylvania.
And I'm Rachel Kelz. I'm an endocrine surgeon and health services researcher at the University of Pennsylvania.
So just to begin with, can you tell us a little bit about the background of this study and what prompted your interest in the topic?
There's a lot of literature that shows that different hospitals offer different outcomes for surgical patients. There's a lot of questions about what to do with this information. One approach is, local quality improvement, but that takes a lot of time and energy. A second approach is to help direct patients to the best hospitals to address their needs, which is one major goal of public reporting of hospital quality information. But there is evidence that, patients and referring physicians don't often use data on hospital quality, specifically procedure-specific data on hospital quality when trying to select a hospital for surgery. And it's unclear whether these high-quality hospitals are even accessible to patients or how much patients would benefit by treatment at alternative hospitals. So that's what we really wanted to study, and we did a simulation analysis to evaluate the potential outcomes that patients would have if they were treated at their best local hospital.
And I guess the motivation for the topic came from a 25-year history of trying to eradicate disparities in surgical care. And, I've been working at the bedside and working to identify areas for improvement. And you can make small incremental improvements at each local hospital. But if you want to try to look at things that can improve our journey towards health equity across systems, I felt like I had to take a step back and reevaluate. And while there were clearly a lot of terrible things that came out of the pandemic, one of the good things about being locked in my house was that I couldn't do the community engagement and outreach activities that I had been doing in Philadelphia. So I had to figure out another way to try to pivot and get at systemic opportunities to improve care, and looking across all the variations in outcomes, across hospitals within a city, within a region, within a state, gave us the idea that we could perhaps do some simulation studies to see if there would be a way to eradicate disparities by trying to direct patients to their best local hospitals.
Absolutely. It was a really, really interesting study, and I'm looking forward to talking a little bit more about it. So first, where did the data come from, and what did you do in the study?
For this study, we used data from the Florida Agency for Healthcare Administration, which provides hospital discharge data for patients treated in Florida. And we included adult patients who underwent surgery for colorectal neoplasm in Florida between 2016 and 2019. For the study, we did it all in simulation. So we took patients that were treated between 2016 and 2018 and used their outcomes to assess hospital performance for colorectal cancer surgery. And then using some Bayesian modeling, we looked at the patients treated in 2019 and asked, what would their potential outcomes be at each hospital within 30 miles of their home? And then we compared these potential outcomes at their chosen hospital and their best local hospital, which was defined as, the hospital with the best outcomes for them. And our primary outcome measure for the study was something called social welfare, which is a composite measure that balances the reduced in-hospital mortality that's gained from, alternative hospitals, but balances that with any associated costs of care at these better hospitals.
What did you find?
Several interesting findings from this study. First, we found that for patients in our cohort, approximately 60% were not treated at their best local hospital. So we were able to find another hospital within 30 miles of their home that could potentially offer them better outcomes. And in these simulations where, a patient was treated at their better local hospital, we found that these alternative hospitals would potentially decrease in-hospital mortality from, on average, 0.91% to 0.67%, which are small absolute numbers, but the relative decrease was about 26%. This was all associated with increased hospital costs by about $500 per patient, but combining kind of the value of life gained from reduction in hospital mortality with these increased costs, we found a net benefit of approximately $2,000 per patient with colorectal cancer. And the final interesting finding was that these higher performing hospitals were not actually farther away than the hospitals where patients were treated. Median travel distance was only 1.9 miles different for patients treated at their chosen hospital compared to the best potential local hospital.
But in many cases, people were literally driving past a better hospital to go to the hospital where they actually received care.
Yeah, I found that last point to be very interesting because really that's sort of one of the practical questions, certainly. Really, really interesting findings. Could you talk us through your analysis related to the impact of hospital on health disparities?
Absolutely. So we stratified our analysis by race, looking at Black and white patients to see whether this sort of intervention would impact the populations differently. We found, consistent with many other studies, that Black patients have higher rates of in-hospital mortality compared to white patients. But we found that our intervention reduced in-hospital mortality similarly for both Black and white patients. So, it improved care for everybody by kind of a similar amount. The disparity remained, but was slight, which is kind of consistent with other studies saying that there are disparities kind of across the spectrum of surgical care. But one kind of caveat that I want to mention is this was just data from a single state. And so we would like to study this on a wider scale to see whether this sort of intervention could be used to reduce disparities on a national level.
A lot of important implications, and that kind of segues into my next question, which is, what do you think are some of the next important and potentially unanswered questions in this area, or maybe work that you may be conducting in this space in the future?
We've taken this work and we're actually moving in a number of different directions with it. We're very fortunate to be doing a very large study now using Medicare data, where we're going to be able to do the same type of simulation study to see within each centrus across the entire country whether or not we can see improvements in surgical outcomes using what we call data-driven hospital selection. The general idea that drove this study and has informed our future work is we want to make it as if every patient in the country has access to a best friend who's a surgeon in their local market and can say, this is the person you want to see because they have the best surgical outcomes for patients like you. Because there's a lot of interaction that goes on between the patient and their hospital and their doctor, and those interactions are seldom considered when looking at the outcomes research that's already publicly available. So we're going to do the study at the national level, which we're very excited about. I'm hoping that not only are we going to see improvements in outcomes for patients of a variety of different races and other backgrounds, but I'm hoping we're also going to see at the national level that we can see a narrowing of some of the disparities gaps that exist. We're also looking at this through another lens, which is the workforce lens, and we see that there are disparate patterns of referral to men and women surgeons. This has been documented in several studies already, despite no differences in outcomes. And so we're also going to start to look at whether or not using this type of a referral system might normalize or equalize the way in which people are referred to surgeons, which will improve access of patients to the whole surgical workforce instead of just specific members of the surgical workforce that their primary care doctors may have access to. And that, I'm hoping, is going to bear fruit in a couple of different directions. We're also using this work to develop a provider referral system for use within our own health system. So we're working on trying to establish a way in which we can give primary care doctors the information they need to help patients find the right place for them within their local market to receive care, so that we can make care more accessible to a primary care doctor's patients when the primary care doctor may have a more limited referral network.
Really looking forward to getting to hear more about it in the future. Any final thoughts regarding this study or anything that we didn't cover?
I think we're both really grateful for your interest in this work, and I'm hopeful that in sharing the concepts with the readership, the listeners, that people will start to think really critically when they're referring somebody for surgery. Do they really know anything about the performance of that hospital or that surgeon for this specific disease process? And is there a place they can find that information to help their patient find the right place for themselves?
I think that's a great thought to end on. Thank you so much to the both of you for speaking with me today about this really important topic. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. I'm Angel Desai. Thanks for listening.